MSI testing is something that's very unique. As we all know, for the first time in the history of cancer, the FDA has approved a drug based upon not a location of where the tumor started, but based upon a molecular test, which is MSI. And I think that's very important because MSI is expressed in multiple tumor types, very small percentage. So there's a bit of controversy right now. Should we be testing every patient that comes through the door for MSI? And I think it's not yet settled what's going to happen. What we do at our center is we test certainly the disease areas where there's a slightly more common predominance of it, so colorectal cancer, endometrial cancer. But for the others, we tend to test it as part of a panel, maybe in the second and third line setting when we're running out of options. But I do see a day when potentially MSI is going to be part of this whole panel that we do of tumor mutation burden, other markers, all one stop at the get-go. And as costs come down, this will be a practical reality. We consider TMB as well, and there is a little controversy whether TMB and MSI are completely correlated. There is some correlation there. And depending upon which test you use, which company you use, they'll tell you TMB, MSI either separately or not. And I think that is an important biomarker. I don't think it's ready for prime time yet because there's not a drug approval based upon TMB, but it's based upon MSI right now. Whether you can use one as a surrogate for the other, I think is still an open question.